Thank you for joining me here on Healthy Hot Air. Camden Smith with you. We're always talking about eating healthy, exercising, and keeping yourself in shape so we can live a longer, healthier life. And of course, part of that is brushing and flossing your teeth. My dad, who's a dentist, is joining us, so of course I trust him. He's my dad. He's been handling my teeth and all my not flossing most of my life. Recently I had a cavities in my 30s and I got the big lecture that was a little ridiculous, right?
Right. Especially for my daughter, who knows better.
So joining me is, of course, my dad, Dr. Garry Smith. He has a practice in Fishers and Anderson, Indiana. Dad, talk to me really quickly. People think, well, you know, I can always get dentures. There's no big problem. Most people try to brush their teeth. They like to have good breath. But there's a long-term problem if you end up with dentures, and there's a way to avoid it, correct?
You're talking about bacteria, or are you talking about diet?
Diet.
Diet, yeah, because they eat a softer diet. Most likely it's higher in carbs, lower in protein, and it's a bad diet. The bacteria that cause tooth decay, gum disease, and bad breath, even though they don't have any teeth, also cause problems in the colon. So people who have cancers of the colon and stomach, usually it starts with bad body chemistry in the mouth.
And that just gets out of control.
Yeah, you get more of an acid diet.
Now with dentures, what you're saying, and we're not saying that if you have to get dentures you shouldn't. We're simply saying if you can keep what you have, it's a good idea because that's a longer, healthier life. And my grandmother was able to keep her teeth. And she ended up lasting a lot longer and healthier than we thought she would.
Right.
With bacteria, what role do dentures play in bacteria in the mouth that go throughout the body?
Well, since dentures are porous plastic and not hard enamel, the bacteria that are in your body can get impregnated into the plastic. Well, that's okay if you're normal bacteria. However, if you get sick, you get a cold, and you're okay, and then you get the flu, time goes on, 2 or 3, 4 years of some of that going on, the bad bacteria are living in the plastic. So they are becoming bigger in number, they're going into your digestive tract, and now you start getting health problems down the road.
So if you keep the bad bacteria in your mouth, eventually they go throughout the body and they cause problems.
Right.
So how often do you recommend people replace dentures if they have them?
Well, they should replace them every 3 to 5 years, but that's not happening.
Right. Now, one of my grandparents didn't want to replace his dentures for 10 years.
And he did okay.
He did okay, but he had trouble eating.
Right, but we also sterilize his dentures frequently.
Right. So you need to try to replace your dentures every 2 to 5 years if you can.
3 to 5, 2 to 5.
Right. And make sure you're sterilizing them regularly, which any dentist can offer, correct?
Yeah, you can go to any office and ask them to put them in cold sterile for 24 hours, and they'll get those bacteria out of there.
So here's to staying healthy. Of course, it's nice having teeth, but if you have a loved one you're taking care of and they have dentures, or you're having some partials or issues yourself, make sure you're getting that bad bacteria out of your mouth, because everything that we have in our mouths or we put in our mouths goes throughout our body and ultimately affects our long-term health. Thank you for watching this episode of Healthy Hot Air, and don't forget to subscribe as you see it on the screen below. Thanks, Dad.
You're welcome.
And we'll see you next time.